There is something I want you to understand before we begin. When your vision starts to fade after 60, the most dangerous thing you can do is tell yourself it is simply age. That single assumption, quiet, reasonable, entirely understandable, what causes millions of older adults to lose vision they did not have to lose. Not because medicine failed them, because they never asked the question. I am Dr. Hiroshi Nakamura, and I have spent more than 25 years in clinical medicine working closely with older adults. A significant portion of the patients I have seen over the decades arrived in my office having already decided on their own that what was happening to their eyes was irreversible. They had watched their world grow dimmer, blurrier, smaller, and they had accepted it. What I found in case after case is that acceptance came not from a diagnosis, but from an assumption. And assumptions in medicine can cost a great deal. Today I want to walk you through 5 eye procedures that are available to people over 60. Procedures that can, in the right situations, restore meaningful vision, protect independence, and prevent the kind of slow withdrawal from daily life that begins when you can no longer read a label, drive safely, or see someone's face clearly across the room. I am not here to tell you that any of these procedures is right for you specifically. That requires a proper examination by a qualified eye specialist. What I am here to tell you is that the question is worth asking, and that asking it may change far more than your eyesight. The first procedure is cataract surgery. Most people over 60 have heard the word cataract. Far fewer understand what it actually is, and even fewer realize how completely it can be corrected. Think of the lens inside your eye as a small transparent window. In a young healthy eye, that window is clear. Light passes through it cleanly and lands on the retina at the back of the eye with precision. But over the years, the proteins that make up that lens begin to break down. They clump together. They cloud. The window that was once clear becomes frosted. And frosted glass, as you know, lets in light, but it does not let in clarity. This is what a cataract does. It does not turn off your vision like a switch, it dulls it. Colors fade, contrasts flatten. At night, headlights become halos. Reading requires more light than it used to, and then more than that. And at some point, you realize you are avoiding things, driving after dark, reading for long periods, entering unfamiliar spaces, because your eyes have quietly made those things feel unsafe. What I want you to know is this. Cataract surgery is among the most successfully performed procedures in all of medicine. The clouded lens is removed and replaced with a clear, permanent artificial lens. The procedure itself typically takes less than 30 minutes. The recovery is measured in days, not months, and for the large majority of people who undergo it, the results are not subtle. Patients describe the world becoming vivid again. Colors they had forgotten, the blue of the sky, the sharpness of text on a page, return. I remember a patient I will call Miyuki. She was 71 years old when she first came to see me. She was a retired school teacher, meticulous in her habits and deeply private about any sign of physical decline. She had been struggling with her vision for several years. Yellow-tinted light, difficulty with her evening reading, a persistent discomfort when driving, but she had attributed all of it to aging and had said nothing to anyone. When she finally mentioned it, almost in passing at the end of an unrelated appointment, I referred her to an ophthalmologist. Cataracts were found in both eyes. 3 weeks after surgery, she called the office. She said very quietly and without any drama, "I had forgotten what sharp looked like. If your vision has been fading gradually, not suddenly, but slowly, over months or years, and if you notice glare, faded color, blurring that no prescription seems to fully correct, please do not assume you have exhausted your options." Ask specifically about cataracts. The examination is simple. The answer may not be. The second procedure involves laser treatment for glaucoma. This one requires a particular kind of attention because glaucoma is dangerous not because of what it causes you to feel, but because of what it causes you not to notice. Glaucoma in its most common form is a condition in which pressure builds gradually within the eye. That pressure damages the optic nerve, the cable that carries visual information from your eye to your brain. And it does so quietly. There is no pain, there is no sudden change. The peripheral vision narrows slowly over years in a way that the brain partially compensates for, and the patient rarely detects until the damage is substantial. This is why I use the phrase that many eye specialists use, glaucoma is a thief. What I want you to understand about laser treatment for glaucoma is that it is not a dramatic intervention. It is a precise and relatively brief procedure designed to improve the drainage of fluid inside the eye, which in turn reduces the pressure that is damaging the optic nerve. It does not reverse damage that has already occurred. Nothing does. But it can slow or stop further loss. And when you are talking about a condition that moves silently over years, stopping the progression early is not a small thing. It is everything. The reason I emphasize this is that older adults with glaucoma are often managing eye drops, attending regular appointments, and quietly wondering whether it is all making a difference. If you are in that situation, or if you have not had your eye pressure checked in several years, I want you to pay attention here. Glaucoma screening is a simple, painless part of a standard eye examination. The window for meaningful intervention is wide, but it does not stay open forever. The third procedure is retinal injection therapy for macular degeneration. I understand that when I say the words injection into the eye, many of you will feel a strong and immediate reluctance. I have seen that reaction in patients for many years. I want to address it directly because that reluctance, entirely natural, sometimes prevents people from receiving treatment that could preserve the center of their vision. Macula is the small central region of the retina responsible for your sharpest, most detailed vision. It is what you use to read, to recognize faces, to see fine detail. Age-related macular degeneration, in its more aggressive wet form, involves the growth of abnormal blood vessels beneath the retina. These vessels are fragile, they leak, that leakage distorts and damages the macula. The treatment that has changed the landscape of this condition over the past 2 decades involves injections of medication directly into the eye. These medications, called antivascular endothelial growth factor agents, though you do not need to remember that name, are designed to stop the growth of those abnormal vessels and reduce the leakage that is causing damage. In a significant proportion of patients, they do not merely slow the progression. They improve vision that had already begun to decline. I want to be honest with you about what the procedure involves, because I believe honesty reduces fear more reliably than reassurance does. The eye is numbed with anesthetic drops before the injection. Most patients report feeling pressure, not pain. The procedure itself takes only a few minutes. The eye is monitored afterward. This is not a comfortable experience, but it is a brief one. And for someone who is watching the center of their vision erode, it is a choice worth understanding fully before declining. The most important thing I can tell you about macular degeneration treatment is this: the earlier it begins, the more vision there is to protect. If you have noticed a dark spot in the center of your vision, or if straight lines appear wavy or distorted, do not wait to see whether it resolves. It will not resolve on its own. Speak to an eye specialist promptly. If any of this sounds familiar to you, any of these signs, any of these concerns, I want you to write yes in the comments. It helps me understand who is watching, and it may remind someone else reading those comments to take their own symptoms seriously. The fourth procedure is eyelid surgery for vision that is being blocked by drooping lids. This one is frequently misunderstood, and I want to address that misunderstanding carefully. When people hear eyelid surgery, they often think of cosmetic procedures, something done for appearance, and there are certainly cosmetic eyelid procedures. But what I am describing here is something different. It is a functional procedure, and for a meaningful number of older adults, it addresses a problem that is directly interfering with safety. As we age, the skin of the upper eyelid can stretch and sag. The muscle that lifts the eyelid can weaken. In some people, this process reaches a point where the upper eyelid descends significantly into the field of vision. Not dramatically enough to be obvious in conversation, but enough to block the upper portion of what the eye can see. Stay with me for a moment, because this is the part that matters for safety. Vision is not only about sharpness, it is about the full field of what you can perceive. When the upper field narrows, when the eyelid is blocking what you would normally see above your direct line of sight, your brain compensates by slightly raising your chin, tilting your head back, or increasing effort to see clearly. Over time, this creates fatigue, headaches, a persistent heaviness around the eyes, and most importantly, a reduced awareness of what is happening in the space above and around you as you walk, navigate stairs, or move through unfamiliar environments. Falls in older adults are rarely caused by a single dramatic failure. They are usually caused by a margin that has become too thin, where reaction time balance and visual awareness have each been slightly compromised, and one moment requires more than all of them together can provide. Removing an obstruction from the visual field does not solve all of that, but it restores a margin that should not have been lost in the first place. A functional blepharoplasty, the surgical correction of drooping lids when they are impeding vision, is typically a relatively straightforward outpatient procedure. If you find yourself tilting your head back to see clearly, or if you feel that your eyes tire much more quickly than they used to, Raise this specifically with your eye doctor, not as a cosmetic concern, as a functional one. The fifth procedure addresses something that confuses a great many patients, and that confusion is entirely understandable. Some people who have had cataract surgery, people who saw clearly for months or even years afterward, begin to notice that their vision is becoming cloudy again. The natural conclusion is that the cataract has returned. This is almost never what is happening. When cataract surgery is performed, the natural clouded lens is removed, but the thin membrane that surrounded it, called the posterior capsule, is typically left in place to support the new artificial lens. In a proportion of patients, over time, this capsule itself becomes cloudy. The medical term is posterior capsule opacification. The practical experience is a return of the blurring and glare that cataract surgery had resolved. The treatment for this is a laser procedure called a YAG capsulotomy. It takes only a few minutes. It is performed without any incision. A laser creates a small clear opening in the clouded capsule, restoring the visual axis. The improvement is typically immediate. Patients often notice clearer vision the same day. And unlike the original cataract, this clouding, once treated, does not return. I mention this because I have spoken with patients who had cataract surgery years ago, believed the results had worn off, and had simply accepted the return of blurry vision without asking whether anything could be done. The answer, in many of those cases, was straightforward. The problem was not that the surgery had failed. It was that a second, far simpler step had not yet been taken. I want to spend a moment on something broader, because the 5 procedures I have described are not the point in themselves. They are examples of a larger principle. The body does not age uniformly. Some of what feels like inevitable decline is actually a specific condition with a specific cause and a specific treatment. The challenge is that the experience of gradual change, gradual dimming, gradual blurring, gradual withdrawal from the activities that require clear vision tends to normalize itself. Each week is only slightly different from the last, and so the threshold for seeking help keeps moving forward, just out of reach. What I would ask of you is this: do not let gradual become permanent through inaction. If your vision has changed in a way that is affecting how you move through your day, how you drive, how you read, how you navigate unfamiliar spaces, how well you see faces across a room, that change deserves a proper examination. Not a reassurance, an examination. The eye is not a passive organ, it is a living system. And in many cases, the visual loss that feels like aging is something more specific than that, and something that medicine can address. The body, even in its 7th and 8th decades, has a remarkable capacity to respond when the right conditions are restored. I have seen patients in their 70s see clearly again after years of gradual decline, not through extraordinary measures. Through a timely, appropriate intervention that someone finally took the time to explain to them. You are not powerless in front of your own vision, but you must ask the question. You must walk into an ophthalmologist's office and say, "I want to understand what is happening to my eyes and whether anything can be done." That conversation, calm, specific, without assumption on either side, is where clarity in every sense of the word begins. If this was useful to you, I would ask that you subscribe to this channel. I will continue sharing what I observe in clinical practice, not to alarm but to inform. Because the gap between what most people are told about aging and what is actually possible for the aging body is wider than it should be. And that gap is worth closing, one honest conversation at a time. If you are watching this and you have been putting off an eye examination, perhaps for months, perhaps longer, I want you to write in the comments how long it has been, not as a confession. As a reminder to yourself that the time to ask the question is now and not later. I am Dr. Hiroshi Nakamura. Thank you for your attention today. Take care of your eyes. They are doing more for your independence than most people realize until the moment they begin to fail.